Wow, Huples. Just want you to know something. So there's been 1 million cases passed today, and today is April the 2nd. So there's been 1 million actual tests done that have confirmed COVID-19. So that should give you the idea that this is not just the flu, nor is it something that is no big deal. Out of those, 51,000 have died and 200,000 have recovered. So that's great news. So far, from all the infections, 1 in 5 have recovered. The rest are either dead or still sick. It doesn't take much of a mathematic brain to realise that the death rate is currently around about 5.1% globally from all confirmed cases. Confirmed cases being people sick enough to be tested. Now bear in mind, large numbers of countries are not doing really any testing at all, and other countries aren't testing people who've obviously got it and need ventilating because they're too sick and there's no point. And a lot of countries aren't testing post-death. There's a whole bunch of issues there with the testing. So the point is that the death rate from this virus, the SARS-CoV-2 virus that causes COVID-19 disease, is an order of magnitude higher than anything we've experienced as a global pandemic in my lifetime, and I'm 55. I would say we haven't had anything on this order of magnitude since 1918, 1919, when Spanish flu killed about 50 million people worldwide. I would be very surprised if we can hold the world death rate below 50 million for this. But I'm hopeful, but I don't think we will. So when you accumulate all the case figures that we have today, bottom line is here, out of the people who have not recovered from COVID-19 and have not died, a total of 95% of them are in mild condition and 5% are in serious condition. So that's pretty good news. If you catch this, you've got about a 95% chance of being okay. And that's great news. Very great news. If the virus mutates and it is an RNA virus, if it mutates and becomes more killing than it is right now, that's going to be really bad. But even at this, it's only 5% of the cases get really sick. When you're talking about order of magnitude in the millions to 10 millions and in the hundreds of millions and possibly in the billions of infected, that's a huge number of people. Now, one thing's for sure, healthcare workers, doctors, nurses, respiratory therapists, PSWs, cleaners, etc. get this virus much more often than the general population because we're the ones dealing with the COVID-19 patients who've got a high viral load. And a lot of us are dying all across the world right now, including in America. And I expect Canadian nurses and doctors to die from COVID-19 disease. I don't think there's any way out of that one. So everybody in healthcare is very, very stressed right now. But I just want to talk about why I think, and there's a lot of statistical stuff not available, why I think doctors die more often or more likely to die than ICU nurses, and I think it's kind of really important. And I want to talk about what I think the reason is and what I think we should be doing to prevent that when the massive surge comes to Canada or to the part of the world you're in if you haven't already experienced the surge. So I'm just going to go through a few reports, and the links will be in the description. For the average American, the average Canadian who doesn't work in healthcare and is actually going to follow the directions that are being given on the timelines that they've been given to practice physical distancing, and additionally you're going to take extra precautions, your approximate chance of catching and dying from this is somewhere in the range of about 0.5 to 0.7%. That's what I've come up with. Maths is a strange thing, we don't have proper data. So for most people, this is still a clear and present danger. If your odds right now of taking this cup of coffee and drinking it to the bottom and you'll be dead in 1 in 200 times if you drink a cup of coffee, would you drink a cup of coffee? The data for Kitty and me is based upon the frequency of deaths and infections in the healthcare population. That's a really critical thing for everybody, especially people in healthcare obviously, but also people who are not. So this one is from early on in the outbreak from China, and they basically say a bunch of things and you can read them and they're important. Most of the caseloads that affected healthcare workers happened in the early surge, when they had a major surge in the early part. So this was from early January from China during the first surge. Basically the major surge happened and a whole bunch of medics and nurses and doctors got sick, mostly because they were not using adequate personal protection. So the disease was less killing than SARS-1 in 2003, and that's great news. But the really sad thing is that they actually known and told us all that personal protection, strong personal protection, of the healthcare staff right from the beginning and all the way through the surge was the most critical factor in preventing healthcare workers getting sick and not being able to care, and also from dying. That was ignored by every single government in the world. So overwork, overloading is absolutely critical. When the surge comes in your institution, you have to not act like it's normal. You can't run around with no gloves on, no mask on, not taking the time to hydrate, not taking the time to think about what you're doing that's putting you at risk when this happens. Yes, you have 30 to 40 patients who need ventilating. Yes, you're not going to be able to ventilate them all and people are going to die. But if you try to ventilate them all, if you try to do the maximum level of care that you can do for all the patients like we normally would in a pandemic surge, you and your co-workers are likely to get sick and some of you will die. PPE ran out in China, PPE ran out everywhere. They had under-anticipated how much they need. I figure we need 5 to 6 million N95s in Canada a day. That's what I think we need, and we're nowhere near that one, and I think that's really sad. It's really sad that we've had plenty of time to do this and nobody's actually got ready for it. And you're not immune to this no matter what you are. The other thing here is that knowledge of using personal protective equipment is inadequate. There's very few nurses that actually use personal protective equipment in dangerous situations on a frequent basis. ICU often does. Emerge not so much, but more than so than other areas. But most of the areas of the hospital are not used to putting an N95 mask on and leaving it on for a 12-hour shift. They're just not used to it. It's not something that is part of what they do. You put a mask on for the 5 to 15 minutes you're in the room, you take it off, blah blah blah, and then wander around and do some chatting. The difference with this is you have a whole bunch of people in the room, all of whom are infected, all of whom can infect you, and you have to be able to function using the best PPE that you've been provided with for as long as possible without contaminating. And as I keep telling everybody, it's the taking off of the PPE that's the really dangerous thing. We've all seen these doctors and nurses outside the hospitals with the masks hanging off here so they can reuse them. If you're going to reuse the mask, don't store it here. The outside of all of these masks are virus bound. So the more videos you've seen, the more times you've tried and practiced with PPE, the more you put yourself and your co-workers in the scenario of massive surge that happens today, happens tonight, happens tomorrow, and goes on for weeks. The more you put yourself in that mindset, the better it is. For example, at my hospital, I've asked for pre-admission criteria, so at a certain point in the surge we can organise a suspension of code blue protocol for cardiac arrests. We can't resuscitate people that have died if we have no ventilators, no staff to do it safely. However, I know they're going to try to do that. They're going to try to do that for far too long, and it will kill people. And I urge and implore medics and nurses out there in the field right now, put yourself in the mindset of a major surge. You have to save the majority of people that you can save in ways that do not infect the staff. And why is that important? Well, I'm a nurse, I don't want to die. Self-interest. The main reason is that when you lose 5 to 14% of your frontline emerge, nurses, doctors, ICU nurses and doctors, when you lose them, there's not enough of us anyway. The people that are being replaced have not got our familiarity with the ventilators, with the equipment, with proning, with dialysis, with all the other technical stuff that we do. They don't have that, and that loss is huge, and that puts an even further burden on the survivors, the people who are not in quarantine, the people who haven't died yet. Those nurses, those doctors are going to have to be even further stretched. And as an example, 11 out of 14 floors in one Spanish hospital are now entirely COVID. In my hospital we have 3 dedicated COVID floors right now, and we haven't had the surge out of about 14 floors. That will rapidly rise, and I can very imagine in a city the size of Toronto, Canada, that we will end up with 11 of 14 will be COVID only anyway. We're not going to be able to do much of anything else. It's going to be an absolute disaster. But knowing there's a storm coming, knowing the tsunami is hitting us, we need to get our gear ready. We need to have the strongest possible PPE available. If we don't have that, we need to improvise PPE. Rather than no gowns, people need to wear trash bags and be encouraged to do so safely and to take them off safely. Just reiterating over and over that incorrect PPE kills you is true. Incorrect use is very dangerous. Make sure people are trained. Make sure people have the right gear. If they don't have the right gear, train them before they have to use improvised gear. But nobody's doing that because we are so stuck in normalcy bias that it will kill, literally kill, nurses and doctors and RTs. So China warned us this was coming, but didn't really warn us. Italy very firmly told everybody around the world to listen to their experience, to get PPE, to get things ready. Spain told us that. The United Kingdom told us that. And yet we're not ready. My hospital is looking with EMAT to look at building unconventional space outside of the hospital arenas. We are expecting that amount of casualties. We're doing what we can to increase our stocks of PPE, but we're still hoarding it and rationing it. And so to this day, nurses in the emergency department are not wearing PPE all the time that's N95. They should be. And every nurse in the hospital should be wearing N95 the whole shift. That's what we did in SARS. But in SARS it was just really Toronto and everybody else was able to help us. In COVID-19 we're all on our own. It's okay for Kumo to go, I need 1 million healthcare workers, I need all of this gear. It's not coming. The other areas need it and they're not going to send it, and for good reasons. We're all going to be on our own. It's going to be appalling and we need to figure out what we're going to do. So one of the things is that mental illness is going to be a very strong factor. Already there's parts of nurses killing themselves in Italy and Spain, and that's absolutely terrible, and I'm sure doctors will as well, because to actually let people die is not something we've been trained to do. But we're going to have to get into our heads real early on that we can't save everybody, and to save the majority that we can save and to protect ourselves, we're going to have to do things slowly, deliberately, carefully, and let people die. And that's not a good information, and people out there to this day are claiming that that's a terrible thing. I mean, the bottom line is, if we lose our healthcare workers who are specialised, the death rate is going to be massively higher than if we keep them alive. We know that a lot of people in healthcare are going to get infected. We know that we're going to lose 10 to 15% by quarantine, by infection, by hospitalisation, and sadly by death. We know that. We have to prepare for that right now. My hospital spent days compiling really complicated staffing models for the COVID ICU and the COVID floors. Awesome, stupid. I could have written it in 5 minutes. I do it all the time. I float staff all the time. But the people who are doing it have no clinical ability to do that and haven't really done it as real. But they spent days doing this. But no, what we actually needed is a model that says, hey, we've got 3 nurses and we've got 58 patients. What's the staffing model going to look like in that case? That's what would actually be helpful. Right? Not how can we keep the staffing ratio at 3 to 1 and then claim that we will close beds if we don't have enough staff. Interesting. We won't be closing any bed or any stretcher. So doctors are hugely at risk, and I said that, and that's what I mean by doctors at risk. The doctors are at risk for a very simple reason. When Kitty had her emergency mass fit test done this week, she was doing it with a junior resident, a trained doctor. He was really nervous and he didn't really know how to handle the N95. Kitty, of course, just threw it on. He goes, whoa, you're a pro with that. And she goes, yeah. They're not experienced. Doctors aren't experienced at using PPE. They're not. Some are, very few of them are. So they're going to do things like cardiac arrest protocol, which they've done with no gloves on, and then they're going to touch the face, and then they're going to die. This has already happened in Europe. We cannot, as nurses and as doctors and as RTs, allow this to happen in Canada. We must take the time to protect ourselves. If we don't have the equipment available, we must make sure we have our own. We have to improvise. We have to make sure we give as much care as we can to the majority of people. We can't try and give really bad care to everybody and then get sick and die ourselves. It's just not an option. This is going to go on for weeks to months. People are dying and we know we're dying. And healthcare workers are in their thousands re-volunteering, re-enrolling in work, being redeployed, and also coming back from retirement. We're not unhappy to do this. We're not unhappy to serve at the front lines to protect the population. We are very unhappy that all of our governments across the world have completely failed us and have not been able to comprehend weeks ago that we needed 5 to 6 million N95s a week or a day, all the time, for weeks to months, and get them done. Now our Premier of Ontario, Doug Ford's doing his best, and I actually trust the guy's going to really kick some butt and get this done.
And right from day one, when it started, I said I want to be transparent. I want everyone to know where Ontario was, where we're at now, and where we could be if we don't take further steps. It's going to be a real sobering discussion, I should say. It's going to It's going to be stark.
But we really have gone late on this, and the warnings have been there over and over and over, and they've been ignored, excused away. You get heads of infectious diseases in my hospital telling people for weeks, this isn't airborne, this can't be airborne. You get people like the head of emergency planning talking to nurses and saying, you don't need a mask to look after this. These people were so stuck in normalcy bias, and still are, that they've literally going to probably kill people. Not on their own, but as a collective response, the normalcy bias is going to kill a lot of people. Do not allow yourself to kill people by that. And I really, really beg all of you out there, do not commit suicide. Don't. You're going to see and do terrible things in the next few weeks to months. It's what we signed up for, but never expected to face. It's not your fault. It's not your fault there's not enough nurses who are trained, that there's not enough beds, that there's not enough ventilators, there's not enough gloves, there's not enough gowns, there's not enough masks. There's not going to be enough medications either. That's a part of this that people aren't really focusing on. But to actually ventilate requires a lot of medications that are probably going to be in short supply. Morphine being one of them, and we already know that heroin is street values going through the roof because they're not getting a supply. And nor are we. And we're going to have to really cut corners. We're going to have to be really dedicated and really, really flexible. No question. This is going to be the toughest thing any of us have ever experienced. This is going to be a generational change for us all. And we were told by Italy, we were told by Spain, we were told by Great Britain and New York, you've got to have the PPE in depth, in strength, there before the surge happens, and everybody using it has to be very experienced and practiced at using it and taking it off, or you are going to lose a lot of healthcare workers, both to quarantine, to sickness, to hospitalization, and to death. It's just not fair. But life isn't fair. As a famous nurse once said to me, and I agree with her, too bad, too sad. Doesn't matter. We have a job to do. We're all going to do it. The things that Prep has said about healthcare workers and police walking off the job and not coming back, very, very few will do that. And the ones who do it probably have good psychological reasons for doing it. We're going to put ourselves in harm's way. We're going to accept the risk. We're going to accept that there's a 2% chance of dying this year because that's what we do. I would implore you, if you work in healthcare or you know people who work in healthcare, or if you don't, to get on the email, get on the phone, talk to politicians that you know identify as being in denial. This is not just the flu, this is not an economic concern, this is a life or death struggle on parallel with World War II. And the people in charge of us have dropped the ball and they keep dropping it. Stop this now. They've got to get their act together and understand that they're in charge of their state, county, town, country for one reason and one reason only: to stop the people who live there from dying. And that's the only thing that matters. We can deal with the economics later on. We can deal with the social stuff later on. Overreaction and preemptive action is absolutely required, and all I'm seeing is foot dragging, excuses and actions that are happening far too late. And this is happening all over the world. This isn't just Canada. Really, really think about what's going on, and I implore everybody out there, stay together, stay in communication with each other and protect yourselves as much as you can. Don't rely on your employer or your government to protect you. They probably won't. If you work in healthcare and you're not collecting your used N95s now and recycling them, please start doing so. You have to. It would be nice if the hospitals were doing it for us, but they're not. We have to do whatever we can do to protect ourselves, and that includes using improvised gear when there is no gear available. That's it from me. Stay safe. Over and out. Toodles. This was a Bad Terrier 2020 production. Just wear a mask. Right, Becky?